Good afternoon, viewers. My name is Java. Hope all of you are doing good and staying safe at home. The COVID-19 pandemic has brought new focus to the health issues like gastric. According to the recent review, 53% of people hospitalized with COVID experience at least one gastrointestinal symptoms. The first person with confirmed COVID-19 in the United States also experienced 2 days of nausea and vomiting before developing diarrhea. And one of the earliest American studies found that around 32% of patients with the disease are diarrhea and nausea or loss of appetite. Today, we have Dr. Kumar Parth with us, who is the Chief Surgical Gastroenterologist at Sagar Hospital, Banshankari. Let me introduce Dr. Kumar Parth to you. Dr. Kumar Parth has done his schooling from one of the prestigious institute, Birla Higher Secondary School, Pilani. He completed his MBBS from Maharashtra Medical Council, Mumbai. He did his Masters from National Board of Examinations. He did his super specialization postdoctoral fellowship in surgical gastroenterology from prestigious Rajiv Gandhi University of Health Sciences. He added feathers to his hat by pursuing multiple fellowships. Those are in advanced laparoscopic surgeries, colorectal surgery, and advanced endoscopy. He had privilege to work in many corporate hospitals like Manipal Hospital, BJS Global Hospital, Bangalore, and currently he is heading the Department of Surgical Gastroenterologist at Sagar Hospital, Banshankari. Also, I guess he comes from a doctor's family. Your mother is a gastroenterologist, right, doctor?
She's a gynecologist.
She's a gynecologist.
Yeah, father is surgeon.
Okay, all right. So, for viewers, in between the discussion, I will ask you one question. The first right answer will get a gift from us, from Sagar Hospital, and we will announce the result at the end of our discussion. As COVID has just calmed down, but it hasn't gone yet. And especially at this time, in the second wave, practically it has knocked almost every houses. Let's educate us with few gastro issues during this post-COVID and how we can take care of these issues. Good afternoon, doctor.
Good afternoon, madam.
So, we have seen that there is a tremendous increase of gastric patient post-COVID in the last 2 years. I mean to say that 2020 and now 2021. What generally are the digestive issues in recovery, COVID recovery?
Okay. So, let me start from our upper gastrointestinal system. Like we have starting from the throat, right? So, people, I'll tell you my crude experience which I'm seeing for last 2 years, and there is a tremendous increase in this symptom in this second wave which we have seen, because
yes.
This mutant virus, I don't know, I mean it has created lot of rust, because lot of last year hardly we used some basic antibiotic also and patients were getting recovered. The use of remdesivir, the use of corticosteroid was hardly in 20 to 30% of the patient. But this time the cytokine storm, the inflammatory process in your body, it was so high that led to overuse of steroids, overuse of antiviral drug like remdesivir, overuse of cytokine suppressant drug and other antibiotics, because of basically why we use antibiotic to protect ourselves from the secondary bacterial infection. It doesn't act on virus, right?
Sure.
And apart from that one, the other thing which I have seen, overuse of this kadha and those things by people, overuse, doing a very hot warm gargle.
I'll ask you that later.
Gargle, yeah. So I'll cover the upper respiratory, means upper GI, then stomach, then the bowel, and definitely come the last part of the bowel, but that is a motion part.
Okay. So around generally, as a survey say that almost around 30% of people are having this problem. While the others generally they do not have post recovery. So what is the difference of this 30% people are having these
Okay.
gastric issues and not others?
Again, I'll categorize those 30% in 10% and 20%. The patient who were in ICU, I'll categorize them in 10%, right? Patient who didn't go to ICU, but they were on the ward, like prolonged hospitalization, just requiring a O2 oxygen support, and patient who were just slightly symptomatic, didn't
Okay.
require any oxygen support, didn't require any medication, but they were there in the hospital for a week
Okay.
and they got discharged.
Okay.
So the patient who were there in the ICU, definitely the bedridden part was more. They were on ventilatory support, or they were on a kind of higher antibiotics, right? The person who didn't go to ICU, but they were on slightly corticosteroid maybe for 4 or 5 days, but the patient who went for ICU, they required the corticosteroid for a longer period of time.
Okay.
Okay. So basically what the problem itself, the COVID infection itself is an infection which affects your whole body, whole organ actually, not only your liver and your heart, your lungs, it also affects the GI system. The only part we keep seeing the lung, that's not an issue actually. The GI part, how they suffered, like either the patient, they showed a symptom of diarrhea, either the symptom of gastritis. What is gastritis? I mean heartburn or acid reflux or nausea or vomiting, or few patients, I mean they have a very vague abdominal pain which stayed for almost 2 to 3 weeks. So I will not say like only this is because of drug induced, because COVID infection itself, it causes GI manifestation because it affects your immune, right?
Okay.
Your gut also has an immune.
Okay.
So your immune system, when it fights with the virus, the immune system is exaggerated, and that's how you use corticosteroid to suppress your own immune, because it's acting on your own body.
Right.
Same time it also affects your gut immune.
Okay.
So when it is over, in a case of excess immune, that point of time when steroid was given, okay, the gut also got subsided, but it lead to ulceration.
Okay.
Most common in the upper gastrointestinal system, we have a stomach, right? So you have a layer of the your stomach, epithelium, gastric epithelium, which get eroded, right? There happen ulceration. It also happen with the use of corticosteroid. It also inflammation, any body inflammation itself shades out your outer epithelium. Coming down to the colon, same thing happen. The colon sites, the cells.
Yeah, my question, doctor, was that why 30% of the people are suffer post-COVID, wherein the others are not?
That's why the patient who are on corticosteroid, the
Okay.
patient who are on antiviral, they suffer more,
Okay.
because the recovery time also prolonged,
Okay.
and the bedridden, the food, because definitely there will be a loss of appetite. Then corticosteroid itself causes gastric ulceration,
Okay.
as well as colonic, the cells of
Is
the,
this the medicine name you are saying?
like
Corticosteroid?
the most common, like methylprednisolone,
Okay,
right?
okay,
Or
okay.
dexamethasone.
So those
Dexona.
who are particularly in this medicine,
yeah.
they are having this.
Definitely,
Mostly, they are having these
because
gastric issues.
you can't withdraw corticosteroid suddenly.
Okay.
So in a case of like methylprednisolone, many trade name, there are Solmedrol, or there are like Predmed. So they were switched on to oral methylprednisolone,
Okay,
or oral
okay.
corticosteroid, whether
Okay.
it was a Dexona, dexamethasone, or
Okay.
it was a methylprednisolone.
Okay.
So moment they switch on to a oral corticosteroid, there we need to taper it,
Okay.
like it was on 32 mg, 16 mg, 8
Okay,
mg.
okay.
Now what happened when you take oral corticosteroid, IV causes slightly less gastritis, I
Okay.
mean acidity in
Okay.
the stomach. But once you take this oral corticosteroid, it removes the outer layer of your stomach.
Okay.
I'll just use a crude layman word.
Okay.
Outer epithelium, it shades off,
Okay.
and that lead to gastric ulceration.
Okay.
So what a sign, the earliest sign you will feel is a bloating.
Okay.
You feel like, I don't have any pain or any acid, but I feel always bloated.
Yeah, I will come back to you on
Definitely.
that, doctor.
Yeah.
So, what is the normal home remedies for that?
Okay, we need some kind of support, because there is a excess acid in the stomach and your surface is not smooth to tackle this acid. We'll have to reduce the load of acid. Most important, we'll have to stop beverages like tea, coffee. In a case of gastritis, I'm telling you.
Okay.
Then we'll have to avoid citrus fruits or lemon, I mean to
Okay.
say.
Okay.
Okay,
So
definitely.
we got a first question of that. Doctor, I have heavy feeling like in my chest, making it feel tighter, also resulting in heartburns and nauseating feeling sometimes.
That's why this is typical sign of gastritis, where you have a excess acid load in your stomach. The typical sign of why the patient is feeling ch chest tightness,
Yeah,
because we'll just switch
yeah,
it
yeah,
here.
yeah.
Okay, chest tightness because your food pipe lies inside the chest, correct? Whenever the acid on your stomach is inside the abdomen, whenever the acid travels from the stomach to the food pipe, it irritates the food pipe, and your food pipe is inside the chest. So definitely you will have the pain in the chest only.
Okay,
You will
okay,
have the discomfort in the neck part,
okay.
or sometimes because of nerve irritation it radiates here and there in the all part of the chest. Slowly what happen, if you have not controlled this gastritis over a period of 4 to 5 days or 1 week, this goes in a phase of anxiety, which is very common nowadays.
Okay, okay.
Now what happens, 70% become anxiety and 30% become the symptom. So that point of time you'll have to tackle both the things. Now you ask me about the home remedies. The most important, I told you to avoid citrus, avoid caffeine, I mean whatever, I mean the tea and coffee, then avoid soda,
Okay,
colas and
okay.
soda.
Yeah, generally we have that. Whenever we
Definitely,
have this
yeah.
indigestion, we try to have
No,
more and more
that
cola
makes them.
type.
What is the funda? People say I take I get relief, right?
Yeah.
That for a temporary, for a time being, it make your media alkaline, but your brain says like it's again alkaline, so you put more acid. It stimulates the hormone gastrin to produce more acid. That time you have a reflux, more acidity. Second thing, the most important, excess use of kadhas.
Yeah, I
Like,
was about to
yeah,
come to that.
yeah,
Um, you know, not in the earlier, like not in 2020 much, but then in the second wave, I could see that most of the people are even advising when we go to the social media that if you have kada every day, at least to some extent, you can avoid having COVID or other related issues what you have. So, what is
definitely.
your take on that?
Yeah, I'm not against of kadhas and those things, though I also take. But imagine like you are not taking anything for last 15, 10 years, 5 years, 10, 15 years, correct?
Yeah.
Now you suddenly start pouring something, I mean, whether it's a pure, I mean, herbal, it's a pure fresh thing, a ginger, anything, just chew one ginger, you will have burning sensation over your cheek. Can you imagine if you put the same ginger and that also crushed one in your stomach where the food need to stay at least for 4 hours? So that causes a chemical, and already you have mild gastritis, so it flares up. Everything to be used in limitation, not like morning and evening. Okay, if you are taking for last 5 years, nothing will happen. But suddenly you introduce something in your diet or in your food which is like creating a problem, definitely it is going to cause you more problem, and that also not need to be taken in empty stomach. That is more important. Many people they have it, which they have started recently actually. Morning they wake up, they first taking the one jug of kada. That is not recommended. You should have some food. You can take any kada or any one time a day, at least 1 or 2 hour after meal, where your food settles down. You have a space in the stomach, so that it should mix with the food and get
Okay.
equal time. It should get absorbed.
So you are suggesting that at least one time we can do that. At least
You
one time
can
we
do
can
that,
have
but
the kada.
if any person who is having gastritis, they should avoid. Stomach will not tolerate,
Okay.
because
Okay.
ultimately they are also chemical. It's a natural chemical,
True.
but that also is chemical. If you have gastritis, it will not tolerate. If you don't have, you can slowly introduce.
Doctor, what are the recovered patients are experiencing stomach or gut pain? So,
Yeah, the
is it anything again related to COVID?
definitely one infection itself lead to inflammation of the gut, of the small bowel and large bowel. Then overuse of antibiotic, whether it's a on counter, whether it's a WhatsApp antibiotic, whether the patient was admitted and got discharged. Now what happened, you lose your natural bacteria in the gut. So what happened, the unhealthy bacterial growth happen in your gut, and that lead to either indigestion. Again, bloating can happen with the large bowel also. So bowel bloats. Second thing, bowel irritates. It may have discomfort, weight discomfort to a certain pain, mostly in the belly button area around. You will have improper stool. Sometimes maybe diarrhea. Sometimes maybe like you immediately you eat food and you go for motion, or
Okay.
you go 4 or 5 times motion. The number of motion increases because the colonocyte, the epithelium of the colon, they get withdrawn. They become bland. we call
Okay.
bald epithelium.
Okay. Okay.
So that time, and what is the remedy? Okay, natural remedy is to boost up that, I mean bald, the epithelium should regrow.
Okay.
Definitely you should not take irritant. Curd and buttermilk, if it suits you, you should take. I'm not forcing, right, because that contains lactose, the natural lactobacillus. And you should introduce green veg in your diet.
Okay.
Again, caffeine and those things to be removed from the
Avoid
diet.
it.
Non-veg should be avoided because your bowel will not tolerate non-veg at this point of time. If you're
So when you talk about non-veg, I can understand, the chicken or mutton and all
Yeah,
this. But
yeah.
then in the northern side, or if you go to the eastern side,
Yeah.
lot of people, they survive on fish eating, or even in the Kerala side. So are you advising that not to
Definitely.
take even fish?
but the fish protein or protein, excess protein, that part of that certain part of time, maybe 1 week or 10 days, will not be absorbed by gut. I don't have idea about the smoked fish, how it works, but I feel a pure vegetarian diet, at least for a week, and soft diet, like not like chapati or not, let's just rice based item, at least for a week or 10 days, because I am seeing in my practice, practically I am seeing it take 3 weeks for the gut to stabilize.
Okay.
I have patients who have crossed 6 weeks also. I have
Okay.
done everything for, finally I have just put them on probiotic
Okay.
and let them heal.
Okay.
Because we use certain kind of antibiotic also for this problem, which are non absorbing antibiotic. We just clean the unhealthy flora from the colon, especially
Right.
colon and small bowel,
Right.
and then we push the healthy bacteria.
Okay. Doctor, what are the long-term GI issues after COVID?
Same thing. Again, COVID diarrhea is like my patient complain, like I go almost 8 to 10 times. So this, until unless your epithelium of the small bowel and large bowel get again replaced by a healthy epithelium, your bowel will not absorb. So this is one thing I am seeing very few patients. Almost I was able to treat almost, I can say, my 80 to 90% of the patient. But the patient who were on corticosteroid for longer period of time, right, or they were introduced some immunosuppressant drug, right, those people, they still, it's my 2 months now. Few people, I'm telling you, 4 or 5%.
Okay.
Still
Okay.
they are still on medicine,
Okay.
supportive medicine. We
Okay.
have medicine like which helps in increasing water from your gut and make the stool slightly firmer.
Looser.
Yeah.
Okay. Okay. So now, as I said earlier, that there would be a question for viewers. It's a very simple question. Guess the place where we are sitting today. You have to guess the place where we are sitting today. The first answer will get a gift from Sagar Hospital. So, okay, let's continue now. That we also have noticed that people are having dry cough, throat pain, choking sensation. Would that be the reason? What would be the reason for this?
I have two explanations for this one, right. One is definitely they have acid reflux. We call GERD symptom. The patient who had mild gastritis before this COVID infection, because of infection, again because of use of those antibiotic and medicine, the gastritis part increases and the gastroesophageal junction is slightly loosened, which lead to the acid which travels from the stomach to food pipe and comes in the throat. Mostly what happen, when sitting hours you will not have acid reflux. It will not come in the throat because it will have to act as anti-gravity. Night part, when you are lying down, it is the very most common, the gastroesophageal reflux disease complex, where the acid comes and irritate your throat. This lead to throat pain, again this lead to chest pain, and again recurrent cough and cold and recurrent pharyngitis, your throat infection. Now second part I told you, this part may be a very mild, I mean maybe like hardly 10 or 20% times where the patient is getting slightly problem, but what happens, slowly when it doesn't get resolved, patient goes in the anxiety phase. I mean they go in the balcony, they breathe a lot. I have a breathing problem, but when they check saturation, it's just like 98%, 99%, how a normal person has. That's basically happening because of your hormone serotonin. These hormones are basically a combat hormone, which help to combat you from a dire situation. Like suppose if anybody open a door suddenly, your heartbeat increases.
True, true,
Because
true.
your hormone called norad and those things comes up in the blood and increase the blood supply should go in the brain, right. We say like some people, they are very soft hearted, they get fainted when they say ghost or something. So these hormone, like typically the serotonin hormone, if this hormone goes in the certain high level, that lead to a chemical reaction.
Okay.
And that lead to an anxiety phase.
Okay.
Even though you have very mild problem, mild to moderate, it becomes severe for you. And you starting having breathing, you go in the daily, I have a patient who visit daily in the emergency department, get ECG done, again come back. So that part of time will have to do
Is with the stress or mental issues
definitely.
or something?
And this
It's a
stress is
mental
not,
stress.
yeah, mental stress. Not only because of COVID, there are a lot of environmental, familial, jobs. I mean, I don't want to go in detail. Everything get combined. I mean, COVID infection itself is a. I have
True.
patient who didn't had COVID infection, who didn't had any problem, but just listening that their distant relative who are there in the ICU or has come to that or whatever, and they are anxiety. They are simply anxiety and they are coming with chest pain and variable pain. This point of time, definitely we need to give support. We need to suppress both the hormonal, I mean, imbalance which is happening, which is causing chemical reaction, as
Right.
well as we'll have to shut down the acid also, which is causing the problem.
Right. So it's just to educate myself that earlier I used to think that cough and cold or throat pain is for something else, but this can be a GI issue as well.
Yes, that is the tip of iceberg. If you are having recurrent cough and cold, if you are having if you are having recurrent throat pain, if you are having choking sensation which happens mostly in the night hours or start from the evening hours, then you should must get evaluated. It may be a gastroesophageal reflux disease where your lungs are clean, but you have a problem with the acid reflux, and that need to be sorted out. It's a really tip of iceberg.
Um, okay, so another question is that, doctor, I'm recovering from COVID and have intermittent pain in the abdomen and infection related to pancreatic. The second is that, advise me the post medication for heartburn. And the third one is that I have heavy feeling like in my chest, making it feel. I have heavy feeling like in my chest, making it feel tighter, also resulting in heartburns and nauseating feeling sometime. I have loss of appetite and at the same time I feel like bloating. So there are a whole lot of questions I read out to you.
The first part I'll tell you, pancreatitis. In
Yeah.
this pandemic, I admitted 4 patients who had COVID induced pancreatitis. They didn't have any gallstone, there was no history of alcohol.
Okay.
It was very bad pancreatitis. Luckily, it's my luck and my patient luck, all got recovered. 2 patients were in ICU, they also got recovered. But yeah, post pancreatitis sequel, I mean, sequelae was like they had to take, they were switched on to some pancreatic enzyme supplement, and the pain, the post discharge pain still continued for 2 to 3 weeks. Slowly they recovered. So pancreatitis, as per COVID induced pancreatitis, mostly they are reversible and they do well long term, because not something like alcohol induced pancreatitis which again it
Right.
keep happening.
Right.
Mostly it recovered, but yeah, the recovery time may be 3 to 6 weeks, depend
Okay.
upon the severity of the pancreatitis.
Okay. Okay.
Okay. Second part, again the bloating part and chest tightness. Okay, it is because of the again excess acid producing in the stomach coming in the, I mean, food pipe which is there in your chest, which is irritating your chest, irritating your neck, leading to a choking sensation. That's what, because this problem must be going on for more than a week and leading to slightly anxiety. So this point of time will have to again suppress the anxiety also. Just forget your body, you don't have any complication, believe me, trust me. You just need a supportive medicine for some acid suppressor
And
medicine.
we always have Dr. Kumar Parth with Southern Hospital. You can always come and consult him
Yeah.
at any point. Yeah.
And most important, don't keep yourself alone, because whenever, and typically this all choking sense and everything happen in the evening hours, we call sundowning, because you are busy in the afternoon. If any, I have a software guy, I mean, patients who are busy, moment they get, I mean, they logged off, the symptom starts, because they start focusing on your chest, on your abdomen. No, they have problem. I'm not saying they don't have problem. They need little bit support and they need to continue.
Okay.
You will have to come out, you will have to do meditation or whatever. Ultimately it's your body, you should control your body should not control you. If you have checked your saturation, it is more than 98%, there is nothing in the heart, nothing. Okay, one time I can't say you don't go to ICU or you go to casualty. Get one single time ECG done. A simple, if you have breathing difficulty, if your saturation is normal, even though I don't feel X-ray, you can get a X-ray also done for your satisfaction, but don't move again to hospital. Just trust your body It's nothing. It's just a simple anxiety and have to come out of it.
Is there any age you have seen, because you are seeing so many patients that 25 to 35 or 35 to 45? What is the age you have seen that this kind of?
Especially 25 to 40.
Okay. That's a long
Because
gap.
this 20, maybe 25, 35 you can stretch.
Okay.
10 years. This age group.
Okay.
Because they are into active job. Okay.
They're sitting now.
Lockdown is one thing, sedentary life. They're not moving out of chair. And I have many patients. The meeting is going on. I can't move on. I mean, they don't take their food on time. Okay,
True,
that again
true.
leading to gastritis.
True.
Because of sedentary, we just keep think our heart. When you run, when you jog, your heart works. Okay, what about the gastro system? Your gastrointestinal system also need blood supply.
Right.
It's a flow of the blood in your bowel. It helps in absorption. You will have to walk in the morning. They say I don't have time. You'll have to wake half an hour before. You'll have to do
Very
it.
true. Very true.
You will have to do.
Very
You will have to keep roaming in between. If you are working from home, please make sure you go and take around again, come back and hydrate yourself. And don't take proper diet and proper time. Small meal. Don't fill your stomach full, because it will start bloating because you are not moving around.
And also we have seen that as because it's a working from home now, people are starting work at 9 o'clock and it continued till 11:30, 12 at night, which earlier used to get over by 6:37 and they used to come back home, which is not happening now.
Yes, and this is called stress. Stress induced gastritis is very common nowadays. I see average monthly more than 100% just simple stress induced gastritis, right? Because there is a hormone called gastrin which is stimulated by your stress and lead to excess acid production. You'll have to cut down, you'll have to do something, yoga, meditation, whatever you want to do, you'll have to tone your body.
Doctor, we are, I think, quite a serious discussion now. If you don't mind, can I ask you some personal questions?
Yeah, sure.
What made you a gastroenterologist?
Yeah, my first choice was onco for cancer, like cancer surgery.
Okay.
But then I realized that I'll be just focused on the cancer only. Where the GI, where the gastro part, because when I just after my post graduation, and when I was in actually post graduation, then I thought ki if I go enter into the GI gastro, I can take over the both cancer and non-cancer, right? And this is, I don't know, GI gastro is one of the commonest problem in the society, right?
Okay.
Every house has one gastritis, not like I just because I'll get more patient, but yeah, my thing was like I should get more, both cancer and non-cancer. It should be like my field starts from the mouth and end till the motion part, right?
Okay.
So I can take care of
The
gastritis,
entire inner circle of the entire.
yeah, starting from the stomach to pancreas to liver to bowel and ending with the piles of fish or whatever.
Okay.
So
That's interesting.
Yeah.
Okay. And would you like to confess today that something about you what nobody knows, not even your wife or your mother?
Difficult question, right? How to answer this one?
Just about yourself that no one knows about it.
Very difficult question.
Something. Yeah, I know it's very difficult, but you can confess. We are all okay. We know Dr. Kumar Parth always on surgery. You can see his attire. He's just back, just 10 minutes before he's just back from OT, and he came rushing to attend the Facebook Live. So
I'm quite anxiety person.
you are yourself?
I myself is anxiety person. And it happened typically not in my family life, really.
Okay.
It happened on the OT table or post op.
Okay.
Really, I don't sleep.
Okay.
If any of the patients somehow, if he got admitted under me and something like, I'll keep watching my phone or whatever, I'll keep Googling about the disease or whatever. But
you keep thinking about the
next,
patient.
yeah, it comes in my mind. I was telling that the patient, right, they feel choking sensation, everything. When they focus their chest, they feel anxiety.
Yes.
It's a very common thing. I'll not say, but I quite get anxiety. Even at midnight, my wife also says, "Hey, you're not getting sleep or what?" Like, I don't know. Today I'm not getting, but I know what my things are going in the mind. Really, it happened. Until unless it gets sorted out.
Okay. So, if you want to contact Dr. Kumar Parth, please call us at 080-4299-999. He is also open for video consultation. For that, please log on to www.sagarhospitals.in and you can book your appointment on the website itself. And let me end the session with a very, very positive note, because we know that we all are going through a very, very tough time. Remember, it will not be this way forever. It will not be this way forever. This is a difficult time, but it is just that, a time. Thank you so much. Thanks for being with us. Stay safe, stay at home. Thank
Thanks
you.
all of you. Thanks Java madam
Thank you,
to
doctor,
give me
for
opportunity. Yeah,
rushing from the OT. Thank you so much for coming.
it was my privilege.
Thank you.